there's plenty of opportunities for you to pursue your own personal interests. They've been very helpful in trying to facilitate those experiences and those opportunities, and I think all my resident colleagues would agree. So after I graduated medical school here from the University of Minnesota in 2008, I went into the Navy and I completed an internship in internal medicine. My experience in the Navy allowed me to understand better what primary care has to offer and certainly appreciate working in a clinical setting and being able to sit down and talk with patients. Well, for one, I think the patient population that we have at the Creekside Clinic is very well-rounded, treating a variety of different ages and age-specific conditions, as well as different ethnicities and people from different parts of the world, which I think is pretty unique. We're very strong, I think, in sports medicine. Our program has had great success in matching residents into fellowship programs over the course of the years. I think a lot of that is due in large part to the opportunities that we have outside of the curriculum.
Sean has benefited from our sports medicine experience, which involves working at two different high schools.
At Armstrong High School, or accompanying Dr. Knopp out to Minnetonka High School, and that way you get to interact with the athletes at their school, within their sports, and you really can get a lot of additional sports medicine experience outside of what's provided within the curriculum originally. The proximity of the clinic to the hospital is one of the undersold benefits of our program. It's very nice because everyone can go to a noon conference that we have, every day, because it's just a 5-minute walk away from clinic. And so you definitely get a little bit, I think, more camaraderie being able to see all your residents and staff on a regular basis.
So I'm a third-year resident and finishing up my experience at Central Clinic. Sean's going to have an opportunity to come and spend time there. And he's really going to experience this really high-volume adolescent and child medicine. And you spend the first 2 years getting trained doing this, and Central Clinic is an opportunity to go on your own without a preceptor there with you, and so you really get to test your knowledge and your comfort level with these types of patients.
In my discussions and interview at Methodist, I felt that they best appreciated the different background that I had and what I was bringing to the table, having taken a little bit different route than most traditional medical students or residents. I'm interested in research and pursuing research and possibly more of an academic career. I felt like they were most willing to work with me and allow me to continue to pursue things like hyperbaric medicine or research. Both the Creekside Family Medicine residency faculty, as well as the subspecialists or the specialists at Methodist Hospital themselves, I think our experience in working with them, and again, as being the only residents around, we get to know them pretty well. So working with the faculty there and the other residents there has been fantastic, and we all get along very well, and it's an open and welcoming environment. So Methodist can provide a great foundation in family medicine.